Hi everybody, Dr. Daniel Martinez here. And today I want to give a public service announcement. There's a lot that's been going around on the internet, especially because of a very famous person that has passed away from a cancer that happens to be the most common cancer that men get, and that's prostate cancer, and the famous person would be O.J. Simpson. We know that prostate cancer is the #1 cancer that men get other than skin cancer. But with that said, it is a very treatable cancer. And the bottom line is survival. In order to survive it, you gotta get diagnosed. In order to get diagnosed, you gotta get screened. So in honor of Men's Health Month, my public service announcement is get screened. Because if you get screened, you got some cancer, you're gonna get diagnosed. If you get diagnosed, you're gonna be able to treat it and you're gonna be able to survive it. What exactly are the current treatment guidelines with regards to, or not treatment, but diagnostic of screening, and when should a guy start to get checked? It all comes down to risk factors. So family history, are you of African American descent or Caribbean descent? Those men who are at higher risk should start earlier, and that earlier is about 40. So at 40 years old, you should be having two things. You should be having a PSA, which is a blood test. It's quite simple. You gotta go and draw blood. The rules: don't be constipated. You should not be sexually active for 24 to 48 hours before. And the second part is you gotta have that special moment with your doctor. You gotta have the rectal exam. Nobody wants to have it done, but you gotta have it done. So if you're at higher risk, you start at 40. If not, you start at 45. Depending on the level, if the PSA is real low and the rectal exam is completely normal, well, maybe you can do it every other year. If the PSA is a little bit higher for younger men, even though the normal levels are less than 4, we like to see them less than 2. If you're a little bit higher, you're probably gonna wanna get screened a little closer, usually every year. Once you get past that 45-year mark, closer to 50, you're probably doing it every single year with that PSA and rectal exam done by your PCP or by your urologist or whoever it is that you feel comfortable with. Prostate cancer is a silent killer, unfortunately. And usually as men get older, the signs and symptoms that men see is really related more to benign issues. If you start having symptoms from prostate cancer, usually that means that ship has sailed and you're probably in a situation where you have more advanced disease. That is why screening is so incredibly important, because you never want to get to that point. Not only that, it's very treatable. It's very curable. So if you catch it early enough, should be a walk in the park. Once things get to that situation where you're having symptoms not related to benign reasons, but because of malignancy, usually it's a little bit tougher.